Hello everyone. Today we are going to talk about the ethmoid, a small bone that is part of the anterior cranial fossa and borders the orbital and nasal cavities. It articulates with the sphenoid at 3 points, with the ethmoidal spine of the sphenoid, with the sphenoidal rostrum, and with the body of the sphenoid, with the palatine via the palatoethmoidal suture at the level of the orbit, a structure near the superior orbital fissure, with the vomer via the vomeroethmoidal suture between the groove of the vomer and the perpendicular part of the ethmoid bone, a union that forms a large part of the nasal septum, with the frontal via the frontoethmoidal suture between the ethmoidal notch of the frontal and the upper part of the lateral masses of the ethmoid. The two bones also join at the level of the orbit and between the nasal spine of the frontal and the vertical lamina of the ethmoid, with the lacrimal bone in the orbit in the ethmoidolacrimal suture, with the maxillary in the ethmoidomaxillary suture, partly in the orbit and partly in the nasal cavities, with the nasal septal cartilage to form the nasal septum, formed by the frontal nasal spine, nasal bones, ethmoid, vomer, maxillary, anterior nasal spine, and finally the septal cartilage. The ethmoid also joins with the nasal bones and with the inferior nasal concha, an independent bone that also relates to the maxilla. The ethmoid bone consists of 4 parts: an horizontal or cribriform plate, a vertical plate, and 2 lateral masses or labyrinths. The horizontal or cribriform plate is located in the ethmoidal notch of the frontal bone. It is called cribriform because it has small holes that are passage points for the branches of the olfactory nerve, the first cranial nerve. It represents the roof of the nasal. It is divided into 2 halves by the crista galli. The crista galli is a section of the vertical plate. It also represents the most anterior insertion point of the falx cerebri along with the foramen cecum of the frontal bone. The plate has 2 concavities, the olfactory fossae or grooves that contains the olfactory bulb of the olfactory nerve. The vertical plate can be divided into 2 portions, upper and lower, divided by the horizontal lamina. The upper portion has a triangular shape and is the crista galli. Here we can see how the horizontal portion divides the vertical lamina into 2 regions, an upper one called the crista galli and a lower one called the perpendicular plate. Therefore, the crista galli of the ethmoid possesses a base that rests on the horizontal lamina, a vertex that offers insertion to the falx cerebri, a posterior portion that joins the sphenoid, an anterior border that articulates with the frontal border delimiting the foramen cecum, an inferior border that contributes to forming the upper part of the nasal septum. In fact, it should be remembered that, as we mentioned earlier, the medial face of the nasal fossa is formed by the nasal septum, which in turn consists of the perpendicular lamina of the ethmoid, the vomer and in part of the nasal bones, the nasal spine of the frontal, the palatine apophysis of the maxillary and the septal cartilage, and that the ethmoid with its lamina cribrosa goes to form the roof of the nasal fossa together with the sphenoid that bounds them posteriorly. The lateral masses, also called ethmoidal labyrinths, are 2 cuboidal structures located lateral to the lamina cribrosa, between the nasal cavity internally and the orbital cavities externally. They consist of a series of cavities, called ethmoidal air cells. 6 faces are considered in the lateral masses. The lateral face is called orbital lamina or lamina papyracea, smooth like a papyrus that it forms part of the medial wall of the orbital cavity. The medial face near the perpendicular lamina concurs to form part of the nasal cavity. From it depart 2 thin curved laminae, called the superior and middle turbinates, or nasal concha. The first 2 nasal conchae are thus part of the ethmoid and form with the lateral mass 2 spaces, respectively named superior meatus, located between the superior nasal concha and lateral nasal wall in which the posterior ethmoid air cells and sphenoid sinuses drain. The middle meatus, located between the middle nasal concha and lateral nasal wall, in which the anterior ethmoid air cells, maxillary, and frontal sinuses drain. The third concha, the inferior one, is an independent bone. The olfactory nerve is purely sensory nerve for the sense of smell. The lamina cribrosa forms the roof of the nasal cavity and is perforated by numerous holes for the passage of olfactory nerves. Branches reach the olfactory bulb, from which the olfactory tract originates and transmits information to the olfactory cortex. Here we can see just the olfactory bulb from which filaments depart and cross the lamina cribrosa. At the level of the horizontal portion are two larger foramen. The anterior ethmoidal foramen, from which passes the anterior ethmoidal artery, a branch of the internal carotid artery, and the anterior ethmoidal nerve that provides sensory branches to the nasal cavity. The nerve is the continuation of the nasociliary nerve after it enters the anterior ethmoidal foramen. It branches into the internal nasal nerves that go to the mucosa of the anterior part of the septum and to the lateral wall of the nasal cavity, and into the external nasal nerves supplying the skin of the dorsal nose and the nasal apex, and the posterior ethmoidal foramen from which the posterior ethmoidal artery, a branch of the internal carotid artery, transits. The Nasopalatine nerve leaves the fossa inframedially through the sphenopalatine foramen to enter the nasal cavity and pass through the vomer. It then passes through the incisive foramen, entering the roof of the mouth, where it supplies the anterior hard palate and the gingiva behind the two upper incisors. From this perspective, we see how the nasal cavities are vascularized posteriorly by branches of the sphenopalatine or nasopalatine artery, terminal branch of the maxillary artery. It is known as the artery of epistaxis because of its common involvement in cases of nosebleeds. Numerous branches of the artery run anteriorly along the lateral nasal wall and turbinates and anastomose with branches of the anterior and posterior ethmoidal arteries. We've concluded for today. I'll leave you the videos to review topics related to what we saw today. Till next time.